Okay, we are starting another clinical conversations episode, and we have Alex Guanco, our Director of Clinical Education at CORA, and we have Ashley Langford, our Director of Clinical Excellence at CORA, and I am Adam with the marketing team at CORA, and we are talking today about lower back pain, and we're going to start by talking a little bit about the prevalence of it. How many people get it, why people get it. We're going to talk about preventing it, treating it, self-rehab, when do I need to go to the clinic? We're going to talk about a lot of different things, but we're going to make it quick. So, Alex, Ashley, where can we start by understanding who gets it, how many people get it?
I mean, the simple answer is just about everyone, right? I think if you haven't had back pain, it's somebody that knows somebody that has had back pain. And a lot of times it makes you lose work, right? You don't go to work or you don't go to school the next day because you just can't. It hurts so bad. But I think that we think of it as an older person issue. And what I mean by older person is anyone that's of working age. But we're actually seeing a lot of kids with low back pain that are in school. So it's really an issue that affects everyone, regardless of age.
100%. So the idea of like why we have back pain is certainly open to discussion. But I find it interesting too, just to think about, as human beings, how do we develop as infants and move and what position are we in and how does that change over time? The amount of general activity that we participate in when we're 8 years old versus 40, and then what positions do we just end up in and stay in for an extended period of time. So as a PT, I've always found it interesting in treating individuals with low back pain just to figure out what's the weak link, what's the missing component, and just the amount of people that come in and completely don't know how to use their abdominals or control their low back. That's a pretty common thing. We lose the ability to feel, move, and control that part of our body.
You mentioned abdominals, which are part of the core, right? And is the core the mechanism to protect the lower back? Is that an accurate statement?
Well, we got to define the core.
Okay, we'll define the core.
Yeah.
Alex.
Core is, for me, anything that is like at the top of your hips, so your glutes, your hip flexors, so the things that like the muscles that actually bring your leg up, your abdominals, your back muscles. So it's your whole trunk and then into your legs a little bit. So it's not just what I call the six-pack muscles, right? Like it's a little bit more than that.
And is it true that we should always be engaging our core when lifting and doing activities that are risky for your back?
So I think that the larger issues come when there's an imbalance, right? When you have a really soft front and a really tight back, or a really overactive front and a very flaccid back. So I think the problems become when there's an unequal pull on either side, because I think we've all seen all sorts of life that you're like, how is that guy moving that without having any back issues? And they're fine. So I think that part of it comes with the push and pull from the front side of your body and the back side of your body. And I mean, sometimes it's just your pain tolerance too.
Yeah.
What you call pain is not what I call pain.
Yeah, that's a good point. I think it is an interesting thing, and it to me it helps you appreciate the human body, like the way that we are designed. We're all obviously different, but what is the optimal state? So can the balance of muscles and dynamic control work in your favor based on what you're doing? So to answer your question, I'm like, no, we shouldn't be using our core all the time, particularly not the same way. And we should naturally kick in certain muscles before the resistance even happens, like a preparatory type control that a lot of people lose. An interesting correlation that I find too in the clinic, Alex mentioned hip flexors and the hip muscles. Many times, if there's a weak overall core to stabilize the lower spine, you'll see it in the hip flexors, like their inability to like actively lift their knee as high as they can. They might be at 60 or 50% of what they should have, and maybe it's not the hip flexors, but it's centrally at the core. It's not engaged.
Yeah, and then you have people like like me, that I never reach the ground when I'm sitting. So I fix that by like crossing my legs onto the chairs or putting one underneath. And then it creates actually either over tightened hip flexors they're not really supporting you, or hip dysfunction that's also not supporting you. So posturally, we can affect ourselves even if we don't mean to.
All right, so there's a good word. You said posture, right?
I
Like
said
that.
posture.
Um, that comes to mind when so when I'm thinking of back pain, lower back, I think posture, I think movement, heavy lifting, and then it goes back to the posture when we're talking about those things, I imagine as well. I think of repetition. So if I'm doing something, but again, I think it all goes back to the posture. If you can do things repetitively, for example, running, I run. Um, if you have a good balance of your core muscles, your mobility, I would assume, your posture, your breathing, like these are all things connected, correct,
Yep.
to potentially inhibiting or creating lower back pain. So I say that because is it too complicated? Is that why so many people have it? So when I'm running, and sometimes I do think about, okay, posture, activating glute muscles, activating core muscles. I think of how hard I'm hitting the ground. I think about how long my stride length is. Is this just too much? Is this like information overload? And that's why people are like, you know what? I have a bad back. Like I just can't deal with all of those things.
I would wager to say that you're probably not in the majority of people. When you're thinking like you just explained and step by step by step, yeah, I think it does become information overload. What we do know about posture is that it's not actually like, there's not a really good link between posture and pain. As far as if you have bad posture, does that cause pain? There's not really a good link to that. What we also know as therapists is that when you're in pain, you have certain postures. So you may walk stiffer, you may not rotate as much because you're avoiding the pain. So your posture, your natural posture, can be changed by being in pain, but a poor posture doesn't necessarily make you have pain.
And posture will be unique to the person, correct? So I know, well, I was always told that I have an increased lordosis or high butt, and that's going to create more tension, I would think, on the interior and more, what would you say, lax muscles on the posterior because it's kind of doing this, whereas the front is being stretched. So my
tighter
posture
on
is
the
going to be
backside, tighter on the backside and looser on the front side.
okay, just the opposite of what I said. Okay, but again, I'm going to be unique. I'm going to be unique to your posture and your posture. So there's not really a bad posture. It's more of a unique posture. And I would say there's also the potential to increase somebody's potential for back pain or any pain really. If I'm trying to get them to be like me, if I'm trying to say, okay, hey, look at the way I stand, look at the way I do exercises. This is how you need to be as well, right? Is that also a safe thing?
Uh, yes, absolutely. And I think one of the strongest things we can do as therapists in the clinic is actually to test and retest. So, in other words, let's say if we're treating you and you've got low back pain and we're identifying that you've got hyperkyphosis in your low back, so too much curvature, it's fun sometimes actually just to take a moment to adjust someone and assess how did it feel in their back to begin with and how did it feel afterward. Many times when you do try to work towards what we might say is more normal for what that's worth, they do feel better. It takes some pressure off. But if it doesn't, that's a cool indication to say, you know what, that's not what I'm trying to strive for necessarily right this second. So
Yeah. And I think that I think as therapists, we have to be careful when we're trying to fit someone into the posture box, right? Because squatting, if you can squat with low back pain, but you can have hip limitations that maybe the next person doesn't have. And so sometimes a squat for me may feel a little better with my feet turned out versus facing my feet facing forward. And if I'm trying to jam my squat into this posture box, I may end up hurting myself because I'm trying to fit into a box that my body won't go. So, but that's part of our job as therapists to be able to say like, hey, this is your body and this is within your realm of movement. And so let's help you move within your realm of movement instead of what I consider to be mine.
and on this topic, what's really cool too, Adam, is and this goes for everyone. we think we know what we look like when it comes to posture, but it is always fun to take someone's cell phone and take a picture of what they look like from, a setup to their natural stance, and it blows your mind. It's a little disappointing, but in your mind you think you've got Tiger Woods feel and hold, and then all of a sudden you look and you're 75-year-old hunched over arthritic man. So recognizing that what we think and then what is reality can be different.
Mm-hmm.
Some of my favorite Instagram reels are what I think I look like, what I actually look like. Okay. Now that leads me then to the next part of the conversation about self-care, prevention. When do I go? When does my back pain signal the need for physical therapy? When does that happen? What can when do I do things at home? When do I pursue seeing a professional?
My selfish answer is like as soon as you start having back pain, like day 2, you can reach out to someone. But from a rehab perspective, within the first 16 days is like our sweet spot. And we don't actually get to see everybody within the first 16 days. If you're starting to go to like, let me wait it out and see, then let me schedule a doctor's appointment, then go through the chain of healthcare. But truthfully, our fastest recovery is going to be within those first 16 days if we can get you. So my educated opinion is within the first 3 days, if it hasn't gone away, then go see someone, specifically a physical therapist.
Yes, 100%. Yep, it is. So one of the nice things that's happened in the past, decade is direct access to in most states. So, people have to know about it too, but most of the time you don't have to go to your primary care doc to go straight to a therapist to get evaluated. And I feel confident that as a profession, we do a good job of identifying, red flags or something that doesn't quite fit the box of this doesn't seem like something a therapist would deal with. We're happy to refer back to their physician. So.
Mm-hmm.
Okay, what about when does a therapist decide, okay, exercise will do the trick. Okay, manual therapy will do the trick. Okay, this guy needs a manipulation. That might do the trick. This guy might need, I don't know, cupping, dry needling, any one of these things. How do you process that?
Good question.
So part of it's time-based, right? So that's where the 16 days comes in. If we get you before 16 days and you fit some other criteria, that's when a manipulation is going to help you best and when it's appropriate. After you kind of pass that, what we would consider acute phase, now we really do go into saying, okay, let's just get you moving. Let's make sure that it's not necessarily, exercise is a very broad term. When we think of exercise, we may think of lifting weights, or we may think of going out for a jog. But really, like maybe you need some stretching, or maybe you just need to learn how to breathe properly again. One of the first things that happens with low back pain is we kind of stop taking deep breaths because we're so guarded. So one of my favorite first things to do on day 1 is like, all right, let's just get you breathing again, like a nice, good deep breath. And that also helps to relax the muscles. So it depends on where you kind of come see a physical therapist and what you need at that particular time. If you're completely in spasm, it's going to be hard to do a manipulation. Your muscles will brace you so that we can't even get you into the proper position. It'll hurt you more. But if you are kind of already a few days out or a couple weeks out, you may be more willing to move. And it's our job to kind of move you within your comfortable range and start pushing it little by little. And then exercise can be appropriate. We do want to keep it, I don't want to say pain-free, but to within your discomfort level, or with whatever you're comfortable with. So if we're going on a number scale of 0 to 10, I try to keep discomfort to a 3 or 4. And within that range, you're still probably pretty safe and not injuring yourself.
I'll speak for just to add value to what Alex has said. First and foremost, she has a history of overseeing and assisting with our orthopedic residency program. So the nice part about having her on the call here is she's very much up to speed on current evidence and what she's speaking to. And correct me if I'm wrong, Alex. She's going off of as physical therapist, we have what's called CPG's clinical practice guidelines, which is just a handful of the strongest evidence and research, and your researchers that get together to make sure that it's updated and current. And we as a profession, we put it together in a nice package that helps us in the profession to decide where do we go with each person based on the way they present.
We have, I like to use the treatment-based classification system. It's not quite a clinical practice guideline, but it's an algorithm that helps us look at each patient, fit them into certain boxes. So basically like, yes, no, does this person fit this way? Yes or no? And then helps give us an idea of where we may be able to start or which direction we should go. So at minimum, we have a nice framework for where we can begin so that we're not aggravating or causing more discomfort to the patients.
Okay, last question. If you are kind of free of back pain mostly, and I say, I'm going to ask each of you, the one thing, if there's one thing I could do, focus on, I know it's a bunch, but if there's one thing I could do to help kind of prevent or keep back pain at bay, what's the one thing you would recommend starting with and doing most often?
Walk.
Oh.
Like often, like go out for a walk. At this point, many of us are sedentary, whether we want to be or not. Most of us are sitting for a good portion of the day. So imagine 8 hours of just sitting, and then you have dinner and driving to work or not, and then sleeping and sitting for breakfast. So we sit a lot of time, and it throws off everything. It throws off our posture. It throws off the strength of our glutes. It makes us tighter in our hip flexors. So just by walking and being in that upright position, helps cardiovascular, helps actually your mental focus, like your mental health. And so I think that's probably the number one thing I would say, to walk every day.
Yeah, the mental health perspective of it, I think, holds a lot more value to many of us. It's probably more of our focus. But yeah, I was going to say massive amounts of ibuprofen, but I like what Alex said. So I was actually thinking, movement, exercise and movement as much as possible. But walking is a nice, simple way to set an expectation that should lower the risk.
I've always heard that the hips are a bad neighbor. Is that accurate?
Yes,
like because they just they'll cause the issues above in the back neighborhood, 100%. And then they'll cause the issues down below from knees, ankle, feet. Like typically things will go back to like the hips, and I guess walking is helpful to your hips. So all right, anything else? I think we can wrap up on this conversation. This was a good intro to lower back pain in general. I think we covered most of the talking points we wanted to. Anything else to add?
I would say you have more, for those of you that are listening in and aren't aware and you do suffer with back pain, you have more control than you likely know. And getting in, speaking with a well-trained physical therapist is worth its weight in gold.
All right. And then I know we're going to talk again, and we're going to jump into some common search queries and what people are actually going to the internet and looking up with regards to back pain. So that will be our next episode. Thank you, Ashley. Thank you, Alex. And we will see you all again soon.
Bye.
See ya.